This is a poster on steps to follow for complete reduction of lumbar posterior derangement. What is McKenzie treatment or mechanical diagnosis and therapy all about? What is its uniqueness? MDT is a comprehensive evidence-based system of assessment, diagnosis, treatment and prevention strategies aimed at patients' education and patients' independence. It is the most cost and time-effective screening tool with its unique classification system, ruling out the red flags and categorizing the patients into different syndromes depending on symptoms presentation and pain behavior. First and foremost step for complete reduction of pain is approaching a credentialed MDT physiotherapist, for which the patient must go through the foremost common referral pathways as shown here in the poster. First pathway is the longest pathway, which not only takes the longest time but is also costlier due to the investigations required before reaching a credentialed MDT physiotherapist. The fourth pathway is the shortest pathway of all, in which the patient directly approaches a credentialed MDT physiotherapist from the clinical locator on Mackenzie Institute India website, who would evaluate the patient using an internationally standardized MDT assessment form taking about 45 minutes, which helps the patient to categorize them with its classification system, as most responders would require treatment for less than 6 sessions, thereby helping the patient and empowering them to stop their pain themselves, reduce the recurrences, and reduce the number of days in an episode. Thus, it helps for complete symptomatic relief and regain all functions in a short duration of time with less number of follow-ups and undergoing investigations only if required, thereby saving on one's time and money. Assuming the patient has unilateral leg symptoms, is classified as lumbar posterior derangement, is approaching a credentialed MDT physiotherapist. Now here lies the management strategy about how Mackenzie treatment would go about. Arrows represents the most common directional preferences displayed by a lumbar posterior derangement. Ladders represents the possible force progressions required for complete reduction of pain. And snakes represents the key points which could halt the reduction and complete recovery of the patient symptomatically and functionally. Now, these are the 3 most common treatment principles used. This is a dynamic extension principle. Here the patient lies in prone lying and does lumbar extensions, and if the improvement plateaus, then these are the possible force progressions required for complete reduction of pain. Next is a static extension principle. This principle can also be used when the need for static force is seen during the assessment. And these are the possible force progressions required if the improvement plateaus. Also, it is used before testing extension with a lateral component when the dynamic extension principle has not yielded any results in symptoms, mechanics and functions. The next principle used is extension with hips off center principle. This can also be used depending on the symptomatic and mechanical responses during assessment. Now here are the possible force progressions required if the improvement plateaus. So a detailed and complete evaluation of a patient using MDT assessment form helps to decide about the treatment principle required. Thus, these treatment principles along with the possible force progressions helps for complete recovery and complete independence of the patient, interlinked with maintenance of reduction by following the key points as represented by the snakes here in the poster, which mainly focuses on maintenance of good posture, avoiding aggravating movements and postures, and performing regular reductive exercises. So one can achieve the best outcome with Mackenzie treatment with the guidance and expertise of a skilled diplomat or credentialed MDT physiotherapist who would evaluate the patient using an internationally standardized MDT assessment form and spending quality time with the patient for assessment and treatment. Thank you.